recent study reported in the September 27, 2013 issue of the journal Nutrients showed a significant improvement in patients with prediabetes who had increased intake of magnesium. This study looked at 234 patients who had prediabetes and followed them for 12 months. They analyzed their magnesium intake and checked their plasma insulin and glucose levels throughout the study to determine how much insulin resistance they had. Those subjects whose magnesium intake was in the top 25% had 71% lower risk of having prediabetes than those whose intake of magnesium was in the lowest 25%. There have been several studies showing that supplementation with magnesium in patients who were already diabetic significantly improved insulin sensitivity. However, this study in Nutrients is one of the first studies that has shown a significant health benefit in those patients who were just prediabetic. Now, another study reported in May 7, 2014, Archives of Medical Research Journal, looked at individuals who had prediabetes and low levels of magnesium. The trial included 62 men and women between the ages of 18 and 65 who had newly diagnosed prediabetes. Participants in this study received magnesium supplementation or a placebo. They also were instructed in a healthy diet and encouraged to exercise. Those individuals who received the magnesium supplementation experienced a significantly greater decrease in their C-reactive protein or CRP levels, which is a marker of inflammation in the body and your arteries. Those receiving the magnesium supplementation also had significantly lower fasting and 2-hour postprandial blood sugar levels. You see, magnesium is also known as nature's own calcium channel blocker and has been shown to significantly lower blood pressure. Magnesium supplementation is also important for patients who suffer from muscle cramps or this restless leg syndrome. There are even studies that show that magnesium supplementation can significantly decrease the frequency of seizures. Recent studies are also showing that magnesium supplementation is important to be taken with calcium and vitamin D when you're concerned about osteoporosis. However, I have found in my medical practice the most important place to consider magnesium supplementation is in my patients who have heart rhythm problems. Before starting my patients on any drugs for arrhythmia problems, I always use aggressive magnesium supplementation. There are several cardiologists who believe that rhythm problems in the heart is one of the first signs of a magnesium deficiency. Therefore, supplementing with magnesium certainly offers several different health benefits.